This is Dory's therapy plan for her language and cognitive communication therapy. So we came up with two long-term goals. One is that Dory will improve her expressive language skills, including word retrieval and her use of vocabulary during conversational speech in all contexts. Short-term goal one is that when presented with a relevant picture or symbol, Dory will name the item with 90% accuracy when given no more than one verbal or visual cue across 3 consecutive sessions. Short-term short-term goal 2 is that during conversational speech, Dory will use word-finding strategies to retrieve a known but evasive word with 90% accuracy when given no more than one verbal or visual cue across 3 consecutive sessions. The third short-term goal is that Dory will improve her ability to answer WH questions during conversational speech with the SLP by answering these questions with 80% accuracy when given no more than one verbal or visual cue across 3 consecutive sessions. Long-term goal 2 is that Dory will increase her auditory comprehension to follow relevant, complex 2 to 3 step directions during structured and spontaneous activities in all environments. Short-term goal 1 for this is that Dora will comprehend and follow a verbal 2 to 3 step direction with 80% accuracy when given no cues during a structured task across 3 consecutive sessions. The second one is that when provided with a verbal list of 5 numbers, letters, or familiar words, Dory will repeat the items listed in the correct order to demonstrate improved short-term auditory memory and comprehension with 80% accuracy when given no more than one verbal or visual cue across 3 consecutive sessions. So, the instructional strategies treatment approach was chosen to be used with Dory. This treatment approach is ideal for older students above the age of 11, according to EBP. And this one is useful because it provides children who are 11 and up with some strategies that they can directly apply to the classroom setting. Dory is adjusting back to academics after her TBI, so this is a great treatment approach to use with her. It includes a few different strategies. One is teaching roles, techniques, and ways to help her acquire information and skills in a variety of settings. The next one is to teach compensatory strategies to help her close the gap between her language skill level and curriculum level language demands that she'll encounter in the classroom. Next is improving Dory's metalinguistic and metacognitive skills to increase her awareness of her own learning and use of these strategies so that she can think about the strategies and use them in the real world outside of therapy too. So some examples of specific instructional strategies that will be used with Dory through this treatment approach include using context to understand the meaning of a message, using checklists or graphic organizers to plan her school assignments, and deciphering complicated words that are specific to school subjects. This might be vocabulary she would come across in math, science, history, or other school subjects. We have some treatment strategies that will be used to improve her cognitive communication and her language. One cognitive strategy is drill and practice. So, since neural networks become stronger with repeated and consistent activation, spaced or distributed practice will help to break her speech therapy sessions into shorter sessions over a longer period of time. This is found to improve recall and carryover of learned information for individuals facing cognitive changes after a TBI. Keeping this in mind, Dory's practice and treatment will be divided into relatively short sessions, but they will be more frequent throughout the week. The next cognitive strategy we're using is errorless learning. This method will be used with Dory by helping to reduce her errors as she learns skills by breaking tasks down into smaller steps, modeling the target behavior, immediately correcting any errors, and fading prompts to help her gain more independence. This method will be used with Dory since her procedural memory is more intact than her declarative memory. This means she remembers how to complete certain tasks that are relevant to her daily life, but she struggles to recall some factual information or to recall events that may have happened. So next we have some language strategies. One is comprehension. Dory will work on completing comprehension tasks to improve her ability to comprehend others' messages. And this may incorporate reading or listening to short passages and stories in therapy. The SLP will provide Dory with strategies she can use to improve her comprehension, including taking time and chunking information together. Next is following directions. Dory will work on following 2 to 3 step complex instructions that are relevant to daily activities and academic tasks that she'll encounter in real life. The SLP will introduce strategies to Dory to aid in her ability to comprehend directions, such as breaking tasks into smaller components, writing commands down, and finding what works best for her. I think this part is important. It's really important for us to see how Dory actually responds to the strategies we give her. Some might not work well for her, and others may work very well. So I think part of this process is seeing what is actually beneficial. But we will be sure to include relevant tasks that are related to school, swimming, and playing piano, since these are things that she does just about every day. And this will make sure that the therapy is relevant for her. And next, we will include expressive language activities. So Dory will work on expressively labeling the names of given commonly used items, tools, and people that are relevant to her daily communication, academics, and activities. Finally, we have a little snippet about the treatment schedule. Dory will receive language and cognitive communication therapy 3 times a week for 30 minutes per session. This is a spaced and distributed practice schedule, which will help to improve the carryover of information and skills she learns. The schedule is subject to change, and it can be changed as needed based on her performance, as well as the opinions of the SLP and her parents. And that's it for the therapy plan.